Hello, everyone. I'm Mary. Over the past decade, I've seen countless men in their 60 seconds plagued by anxiety over changes in their genitals. A 60 to minus year minus old patient, Mr. Wang, came to me privately after a physical. He hesitantly explained that he'd noticed a shortening of his genitals while showering. Worried about a possible illness, he even avoided intimate interactions with his wife. Another retired teacher who just turned 60 lamented daily that his genitals weren't as strong as they used to be, even questioning whether he was no longer a qualified husband. These concerns are isolated cases. They reflect the physiological changes that most men face after age 60. However, influenced by traditional beliefs, many are too embarrassed to discuss them with their families, let alone seeking medical advice. Instead, they keep them to themselves, leading to increased anxiety and negatively impacting their quality of life and mental health. In today's class, I'll explain the realities of these changes from a medical perspective and share a scientific and safe approach to improvement. Whether you've already noticed changes or want to prevent them, you'll find helpful answers here. Before we begin, I'd like to ask everyone a question. Have you ever experienced this? One day, you suddenly notice that your private parts seem less upright than before, appearing shorter, or your skin feels less delicate and elastic, or even just a vague sense of difference, but you can't pinpoint the specific change in. If so, don't panic. According to the guidelines for the diagnosis and treatment of men's diseases in China 23 edition, 85% of men over 60 experience similar changes. This is a natural aging process, not a disease or failure. First, the truth behind private changes after 60, it's not atrophy, but these three physiological mechanisms are at work. Many people attribute these changes to aging, but from a medical perspective, there are actually three explainable and actionable physiological mechanisms behind. Understanding these will help you avoid being driven by anxiety. First, reduced blood flow, not shortening, but insufficient blood flow. The firmness of the male genitals depends on sufficient blood flow to the corpus cavernosum tissue, much like inflating a balloon. When fully inflated, the balloon becomes full and firm. When insufficiently inflated, it deflates and appears small. After age 60, the key factor affecting this inflation lies in changes in the blood vessels. With aging, the elasticity of our blood vessel walls gradually decreases. In youth, blood vessels are like elastic rubber tubes, allowing blood to flow smoothly throughout the body. However, after age 60, the elastic fibers in the walls decrease, while collagen increases, causing the vessels to become stiff and narrow, much like an aging water pipe, slowing water flow and reducing flow. When blood flow is insufficient to reach the corpus cavernosum, it cannot fully expand, resulting in the appearance of being shorter and weaker. However, it's important to note that this is an actual shrinkage of the genital tissue. Rather, it's the perceived and visual changes caused by insufficient blood flow. In my clinical practice, I performed ultrasound examinations on patients. Many who feel their genitals are shorter have only seen their actual lengths change by less than 1 centimeter compared to their youth. The core issue is insufficient blood flow. Second, decreased testosterone. More than just low libido, it also affects tissue health. Many people know that testosterone is linked to libido, but few realize it's also a key hormone for maintaining a healthy genital area. Clinical studies show that starting at age 40, men's testosterone levels decline by 1% minus 2% annually. By age 60, testosterone levels may be 30% minus 50% lower than their youth. Testosterone's effects extend far beyond simply boosting libido. It maintains the elasticity of the corpus cavernosum, keeping the skin of the genital area delicate and supple. It also maintains muscle tone, giving the genital area a firm appearance. When testosterone is low, you'll notice the skin in your private area becomes thicker, drier, and less elastic. The corpus cavernosum loses its tension, so even when engorged with blood, it's less firm, and even the contours of your private area diminish. These changes combined can lead to anxiety about aging. But be aware, not all cases of testosterone decline replacement therapy. If your testosterone level is within the normal range, normal for men after age 60 is 825 ml, a slight decrease can be improved with lifestyle adjustments. Only when your testosterone level falls below 8 ml and you experience significant symptoms such as decreased libido, fatigue, and low mood, intervention under a doctor's guidance is necessary. Third, fat shift. It's not about shortening, but about being hidden by fat. Many people assume that as long as you don't gain weight, fat isn't a problem. However, after age 60, the distribution of body fat changes. Fat gradually accumulates in the abdomen and pubic area, forming a fat pad. This fat pad quietly obscures the base of the genitals. For example, in youth, the base of the genitals may show 3 cm. After a thicker fat pad, only 1 cm may be visible, making it appear shorter. However, the actual length of the genitals hasn't changed, it's simply been hidden by the fat. I once had a patient who was 175 cm tall and weighed 70 kg. He wasn't considered obese, but he had a thick layer of fat in his pubic area. After 3 months of abdominal and pelvic floor exercises, his fat pad thinned, and the visible length of his genitals increased by 2 cm. His confidence also returned. So don't just focus on the scale. Paying attention to fat distribution is more important than focusing on weight. Second, don't ignore the psychological impact of change. Your anxiety may be more harmful to your health than physical change. In my clinical practice, I've found that many patients' concerns stem not only from the physical changes themselves, but also from the psychological pressures they bring. For example, feelings of losing their attractiveness and letting their spouse down, which can lead to withdrawal from intimate relationships, depression, and even disrupted sleep and appetite. From a psychological perspective, men often associate the state of their private parts with their masculinity and self-worth. When they notice changes, they're prone to negative self-talk, believing they're no longer a qualified man. This can create a vicious cycle: anxiety, avoidance of intimacy, worsening mood, increased anxiety. But I want to tell you, the state of your private parts is never the sole criterion for male worth. I've seen many patients over 60 who, despite experiencing physical changes, maintain strong relationships with their partners because they understand that the core of a relationship lies in mutual understanding, acceptance, and companionship, not physical condition. For example, my previous patient, Mr. Wang, noticed changes in his private parts at age 65 and was initially anxious. But after discussing the situation with his wife, she said, "At our age, I care more about the feeling of having you by my side." Mr. Wang then began exercising regularly and adjusting his diet. Not only did his physical condition improve, but more importantly, he stopped focusing on the changes and began enjoying walks and conversations with his wife. This is the core of a healthy life. Scientific improvement methods, from natural adjustment to medical intervention. 3 categories of methods can help you get back to your health. Now that you know the cause of the change, the most pressing question is what can be done to improve it. Below, I'll introduce scientific and safe methods divided into 3 categories. These methods are clinically proven and can be performed at home or under a doctor's supervision without risk. Category 1: natural adjustment methods minus improve basic health through lifestyle. The core of natural adjustment methods is to improve blood circulation, maintain testosterone levels, and reduce fat accumulation. They are suitable for all men over 60, especially those with mild symptoms. First, exercise. Choosing the right 3 types of exercise is more effective than high-intensity training. Many people believe that exercise only works if it makes you sweat and tired. However, for men over 60, choosing the right type of exercise is more important than pursuing intensity. 3 types of exercise are recommended. Aerobic exercise improves blood circulation throughout the body. Examples include brisk walking, jogging, swimming, and cycling. Choose a bike with a wide seat to avoid compressing the pelvic floor. 30 minutes daily, 5 times over. Aerobic exercise strengthens heart function, maintains blood vessel elasticity, and improves blood flow throughout the body, including to the genitals. I had a patient who previously sat for long periods of time, which resulted in poor congestion in his genitals. After consistently walking briskly for 40 minutes daily, he said, "I feel my genitals are more responsive than before." An ultrasound examination showed a 20% increase in blood flow to his corpus cavernosum. Minor schedule exercises strengthen the pelvic floor muscles and improve control. Many people think Kegel exercises are exclusive to women, but they are equally important for men. The pelvic floor muscles are the core muscles that support the genitals. Strengthening them not only improves blood flow, but also enhances control during intimacy. The correct approach: first, identify the pelvic floor muscles. Next time you urinate, try interrupting your stream and feel the muscles contracting. These are your pelvic floor muscles. Once you've found your spot, practice it while you're not urinating. Contract for 5 seconds, relax for 5 seconds, repeat 15 times, and do it 3 times a day. Note to avoid using your abdominal and buttocks muscles for strength, as this can be counterproductive. With 1 to 2 months of practice, you'll noticeably strengthen your pelvic floor muscles and improve blood flow to your vagina. Minus abdominal and pelvic floor fat exercises reduce fat pads and reveal your true length. To target fat in the abdominal and pubic areas, perform exercises like planks, crunches. Do it slowly to avoid back pain, and hip bridges for 15-20 minutes daily. These exercises can reduce abdominal and pelvic floor fat, revealing the base of your vagina for a more defined appearance. Second, eat the right 4 foods to boost your blood vessels and testosterone. The core of this diet is to protect your blood vessels and maintain testosterone levels. 4 food groups are recommended. Minus vascular protectors enhance blood vessel elasticity. For example, citrus fruits, oranges, lemons, grapefruits are rich in vitamin C, which promotes collagen synthesis and strengthens the elasticity of blood vessel walls. Dark green vegetables, spinach, kale, broccoli contain folic acid and vitamin K, which prevent vascular sclerosis. It's recommended to eat 200 grams of vegetables and 100 grams of fruit daily. Honest estrogen guardians maintain hormone levels. For example, oysters eat about 50 grams 1 to 2 times a week are rich in zinc, a key building block for testosterone synthesis. 50 grams per day are rich in protein and diet, which maintain muscle mass and indirectly help maintain testosterone levels. Nuts, walnuts, about 10 per day, are rich in unsaturated fatty acids, which reduce inflammation and prevent a drop in testosterone levels. Blood flow promoters improve local circulation. For example, dark chocolate consisting of at least 70% cocoa contains flavonoids, which dilate blood vessels and improve blood flow. However, limit your intake to 20 grams per day to avoid excessive sugar intake. Ginger, consume 3-5 slices daily. Boiled or stir-fried contains ginger oil, which promotes blood circulation and is particularly suitable for winter. Foods to avoid: don't let your diet hold you back. Limit your intake of high- salt, high- sugar, and high- fat processed foods such as pickles, cakes, and fried foods. These foods can cause hardening of the blood vessels, exacerbate inflammation, and affect blood flow. Limit your intake of sugary drinks, as they contribute to fat accumulation, especially in the abdominal area. Consume alcohol in moderation, limiting it to 25 grams per day, equivalent to 500 ml of beer or 50 ml of liquor. Excessive drinking can inhibit testosterone production and damage blood vessels. Third, sleep and stress management. Don't let staying up late and anxiety steal your health. Many people overlook the impact of sleep and stress on reproductive health. However, clinical studies have shown that chronic sleep deprivation and high stress levels can directly lead to decreased testosterone levels, vastus contraction, and exacerbated changes in the vaginal area. Minus sleep ensures 7-8 hours of high quality sleep daily. Testosterone synthesis occurs primarily during deep sleep at night. If you consistently stay up late and don't get enough deep sleep, testosterone synthesis will decrease. It's recommended to go to bed before 10:30 a.m. And avoid using your phone or watching TV for an hour before bed to prevent blue light from affecting sleep quality. If you have insomnia, try soaking your feet before bed in water around 40 degrees Celsius for 15 minutes and listening to soft music to help you fall asleep. Minus stress management. Learn to relax and don't let anxiety damage your blood vessels. Long-term stress causes the body to secrete cortisol. Excessive cortisol can inhibit testosterone's synthesis concentration, impacting blood flow. You can try deep breathing 3 times a day, 5 minutes each time. Inhale for 4 seconds, exhale for 6 seconds. Meditation 10 minutes a day. Focusing on your breathing or taking up a hobby such as gardening, fishing, or calligraphy to distract yourself and relieve stress. Category to home care methods. Simple and easy to use, 10 minutes a day to improve local conditions. Home care methods focus on local areas, using warmth, stretching, and other methods to improve blood flow and elasticity in the private area. They are suitable for those who want to treat it at home. First, warm towel compress dilates blood vessels and promotes local blood flow. This is the simplest and safest method. Apply 1-2 times a day for 5-10 minutes each time to effectively improve local circulation. The correct method: soak a towel in warm water around 40 degrees Celsius, not scalding the skin, wring it out, no dripping, and wrap it around the private area. Wait until the towel cools before changing it. The warmth dilates local blood vessels, allowing blood to flow more smoothly to the corpus cavernosum, improving congestion. Heat high water temperatures to avoid scalding the skin. Keep the application time short, 10 minutes or less, to prevent localized congestion. Second, manual stretch, gentle stretching to enhance tissue elasticity. This method stimulates blood circulation in the corpus cavernosum through gentle stretching, enhancing tissue elasticity. It is suitable for those experiencing decreased firmness due to insufficient blood flow. Proceed. First, apply a warm towel compress first. Remove the towel after 5 minutes and dry the area. Second, gently grasp the base of the genitals with your fingertips. Do not pinch hard and slowly stretch upward, downward, left, and right. Hold each direction for 10-15 seconds. Move gently and slowly, avoiding excessive force. Third, repeat each direction 5 times for a total of 10 minutes each time. Do this 3-4 times per. Note, this is gentle stretching, not forceful pulling. If you feel pain during the process, stop immediately. Results require persistence. Noticeable changes generally take 3-4 months to be seen. Don't rush. Third, local massage promotes lymphatic circulation and improves skin condition. After showering daily, gently massage the skin in your private area with your fingertips, working from the base to the tip, for 5 minutes each time. This will stimulate local lymphatic circulation and improve skin suppleness and elasticity. You can use a small amount of non-irritating moisturizer such as Vaseline during massage to prevent dryness. Important: use gentle pressure and avoid rubbing too hard to avoid damaging the skin. Category 3, medical interventions. When natural adjustments are ineffective, these methods can help you achieve further improvement. If after 3-6 months of natural adjustments and home care, your symptoms are still noticeable and impacting your quality of life, you may consider medical intervention. But please note, all medical interventions must be performed in a reputable hospital's urology department with a doctor's evaluation and plan. Avoid relying on home remedies or claims from private clinics. First, low-intensity extracorporeal CSWT non-invasive improves blood flow. This is a relatively established method in urology in recent years. It uses low-energy sound waves to stimulate angiogenesis in the private area, improving blood flow. It is suitable for those experiencing insufficient blood flow and decreased erection due to vascular problems. How it works: sound waves stimulate the endothelial cells in the corpus cavernosum, promoting new blood vessels and improving blood flow. They also improve the elasticity of the corpus cavernosum and enhance its responsiveness. Treatment process: each treatment lasts approximately 20 minutes with one session per week, for a total of 12 sessions per course. Treatment is painless with only mild soreness and swelling. There is no recovery period after treatment, and normal life is not affected. Clinical results: according to a 2020 study published in the Chinese Journal of Andrology, 75% of patients who underwent a course of lamented reported improved genital hyperemia and a more perfect appearance, with effects lasting 6-12 months. Second, hyaluronic acid injection, non-surgical, improves dimension. If your primary concern is insufficient thickness in your genital area and you're looking for quick results, consider hyaluronic acid injections. How it works: hyaluronic acid, a substance naturally present in the human body, retains moisture and provides support. Injecting an appropriate amount of hyaluronic acid into the subcutaneous tissue of the genital area increases volume, creating a fuller, more elastic appearance. Treatment procedure: performed under sterile conditions by a professional physician. The procedure begins with local anesthesia, followed by the hyaluronic acid injection. The entire procedure takes 30-60 minutes. Slight swelling may occur after treatment, but it subsides within 1-2 days, and normal activities can be resumed after a week. Notes: the effects are temporary. The hyaluronic acid is gradually absorbed by the body and generally lasts for 6-12 months, requiring regular refills. It only improves dimensionality, not length. The cost varies depending on the injection dose and region, ranging from approximately RMB 21,600 to RMB 72,000 per session. Please consult your local hospital for details. Third, testosterone replacement therapy, TRT, is suitable only for patients with testosterone deficiency. If your testosterone level is below a normal range, less than 8 ml for men over 60 years old, and you experience significant symptoms such as decreased libido, fatigue, and low mood, your doctor may recommend testosterone replacement therapy. Treatment methods: common options include gel applied daily to the skin on the shoulders or abdomen, patch applied to the skin to slowly release testosterone, an injection injected every 2-4 months. Your doctor will choose the appropriate method based on your physical condition. Precautions: a blood test must be performed first to confirm that testosterone levels are indeed low and to exclude contraindications such as prostate cancer, serious heart disease, or liver disease. Testosterone levels should be checked monthly during treatment to avoid side effects such as benign prostatic hyperplasia and blood clots caused by excessive testosterone levels. Not all cases of testosterone decline require treatment. Mild declines can be improved through lifestyle adjustments. Avoid blindly supplementing with testosterone. Fourth, lengthening devices, genital traction for increased length. If your primary concern is length and you're looking for non-surgical options, consider using a lengthening device under a doctor's guidance. How it works: through continuous gentle traction, it stimulates the tissue in the private area to gradually grow, similar to the principle of limb lengthening in orthopedics. How it works: wear it for 6 hours daily, applying gentle traction to the tissue. For 3-6 months, you can expect a 1-3 cm increase in length depending on individual needs. Notes: always choose the right device under a doctor's guidance to avoid purchasing inferior products that could cause injury. When wearing the device, adjust the traction carefully and avoid excessive force to avoid pain or tissue damage. Results require persistence. Don't give up midway. Fourth, finally, I want to tell you your confidence is more important than any method. Before concluding today's sharing, I'd like to share a few more heartfelt words with you. Many people spend a lot of time searching for improvement methods, but overlook the most crucial element: confidence. In my clinical practice, I see many patients whose physical changes aren't serious, but due to a lack of confidence, they exaggerate minor issues, ultimately impacting their lives. I've also seen patients who, despite experiencing physical changes, accept their bodies, communicate openly with their partners, and maintain harmonious relationships. The state of your private parts is never the sole criterion for a happy life. After turning 60, you've experienced the passage of time and have developed a more mature mindset and deeper emotions. These are your most valuable assets. Of course, this doesn't mean you shouldn't pay attention to physiological changes. Improving your physiology through scientific methods can boost your confidence. But more importantly, don't let your physiology define your worth. If you've already tried the methods shared today, please leave a comment to share your progress. If you still have questions, feel free to ask in the comments section. I'll do my best to respond to everyone. Finally, don't forget to subscribe to my channel and turn on your notification bell. I'll be sharing more men's health tips in the future, such as how to regulate testosterone through diet and common misconceptions about Kegel exercises to help you manage your health more scientifically. While aging is inevitable, decline is by no means inevitable. As long as you're willing to use scientific methods to manage your body and embrace change with a positive attitude, you can still enjoy a healthy, confident, and happy life after 60. See you next time.